I just spent like 5 minutes talking and I didn't realize that my phone cut off. We'll try this again. So yeah, I just got off work. I don't have a whole lot to say for this video. I just really came to a realization and I want to talk about a few things just in regards to that. So what I realized today is that I'm looking around at my clinical site and I'm seeing like, dang, I'm the only like black female in here. I think some more, I'm like, dang, okay, I'm the only black PT in here. I realized like between the two sites that I've been to for my clinical rotation so far, I have been the only black female or the only black PT in the room, in the place treating patients. And I was just like, dang, that's crazy. That's why I posted that image today that follow the PT Bay, my new page I just made. You can only be what you can see. It's something like that. You don't see a lot of black PTs in this profession, in this field. So when you think of being a black PT, it's kind of hard to imagine how to get there or see yourself being there because you don't see a lot of people doing it. It's motivated me more to actually create a platform and a forum place for people to congregate and talk about things like this. Realize that we don't have a really diverse profession, which is okay. I mean, it takes time, it's going to get there, but I definitely think it needs to be something that's recognized and we're working towards. Because one thing that I feel very passionately about is that we have so many diverse patients. Like, our profession needs to reflect the patients that we're treating. We need to have people speaking many languages, that have different cultures, different understandings, so we can really relate to the people that we're trying to treat. You're gonna hear me say that a lot of times. And then the other thing I feel really strongly about is that it's not a lot of resources out there. Like, I'll say this, physical therapy isn't in the forefront of like healthcare professions. Most people, you tell them like, I'm a PT, they're like, okay, so you're a personal trainer. I have one of those. And they don't realize like what PT is, what they do, how intricate the critical thinking and what actually goes on in a treatment for somebody that's receiving physical therapy. So that being said, if you don't really know what a physical therapist is, what they do, how do you get to be one, then it's kind of hard to have the resources to become a physical therapist. Because most people know like, oh, you're a nurse, you go to school for 4 years, take your boards. You want to be a doctor, great, you go to school for some years, you do a residency, and then you're a doctor. Most people don't know like all the steps and the levels that it takes to be a physical therapist. They just think like, so is that a bachelor's, is it a doctorate, like certificate, what is it, what do I do, how do I get that? That's one thing that I really hope to educate more people on, is like creating more diversity in the field and just knowing that it's an option. If you want to do healthcare and you're passionate about something like this, I want people who would fit this role to be able to know it's an option and how to achieve that as an option. So we can all achieve our best potential, because I feel like a lot of us, we're not living up to our potential because we're like, I don't know what that is, I don't know how to get there, I'm going to be this because I know how to meet that end goal. But a lot of people, you know, maybe they decide they want to do something in therapy, but they're like, I'm going to do PTA, because they don't know like all the steps, or they don't think that they can do the 4 years of school and the postgraduate degree for physical therapy. So I'm rambling now, but that was everything I really had on my mind at the moment. I just wanted to post a video to be relevant. I'm starting to see a little bit of traction of like the people that I am helping, and like being able to be a resource and a mentor, role model, call me whatever you want. Yeah. That's it.